Hi everybody, I'm Dr. Monica. Today I'll be talking about the anatomy of the human eye. Learning the structures and function of the eye are the best way to know how to keep the eyes healthy and why eye diseases may occur. I will use this model of the left eye and zoom in on each structure. First, let's take a look at the eyelid. These are two movable folds which protect the eye. At the edge of the eyelid are 2 to 3 rows of eyelashes, or cilia. The eyelids consist of multiple layers: the skin, the bicularis oculi muscle, tarsal gland, and the palpebral conjunctiva, which is the innermost layer. This is also the immunologically active layer filled with macrophages and mast cells, which provide a defense against foreign invaders. Now we have the lacrimal system, which produces and drains the tears. The lacrimal gland is divided into the orbital portion and the palpebral portion. This is what secretes the tears. On the side towards the nose is a nasolacrimal drainage system. This is what drains the tears. The little hole is a puncta, which drains in the canaliculi into the lacrimal sac and down the lacrimal duct near the side of your nose. Infants can sometimes get a nasolacrimal duct obstruction, which prevents the tears from draining through the system and can cause a yellowish discharge and tearing. This is the caruncle. There's little hair follicles there and where the debris and gunk collect in the morning. And now we have the eye muscles. These attach to the sclera, which is a white protective outer layer of the eye. The superior rectus muscles at the top, the inferior rectus, medial rectus towards the nose side, lateral rectus towards the ear side, superior oblique, inferior oblique. These 6 muscles are how you're able to move your eyes up, down, and around. All the recti muscles originate in an area back here called the common tendinous ring. The cornea is the transparent and front part of the eye. In front of it is the tear film. The cornea consists of multiple layers, each with a different function. This is the structure on which LASIK and PRK are performed for refractive surgery. The cornea has a dense nerve supply. It has way more sensory endings than the skin. So if you ever get a cut in your eye called a corneal abrasion and you're screaming with pain, it's because of all the nociceptors which innervate the cornea. The conjunctiva is a thin translucent membrane over the sclera. Let's go posterior to the iris, or colored part of the eye. Iris color is determined by the amount of melanin and melanocytes. Greater amounts of melanin give a browner appearance. This hole here is the pupil. During an eye exam, eye drops will be used to dilate the pupil, making it larger, thus making the posterior structures of the eye visible to detect any eye diseases. Between the cornea and the iris is the anterior chamber and the angle. This is the site for aqueous filtration of the eye and one of the areas affected in glaucoma. This outer structure is a choroid. It consists of multiple layers and has a large blood supply. Diseases can occur here, including melanomas and age-related macular degeneration. Here is a ciliary body, which produces aqueous humor, a fluid that nourishes parts of the eye. It has the pars plicata and the pars plana, which produces fibers which connect to this structure here, called the crystalline lens. This is a transparent avascular structure. This is one of the important structures for vision. It gives you the ability to accommodate, which means changing focus of your eyes on objects at a distance and then on objects up close and vice versa. When you're young, the lens is transparent and has the ability to accommodate well. With age, sun damage, or systemic disease, the structure can develop cataracts, causing the lens to change color and lose its transparency, making it difficult to see. The vitreous is the largest structure of the eye. Its main components are hyaluronic acid and collagen. With age, the collagen clumps up, causing floaters, those little things you see floating around in your vision. You can also get some pulling between the vitreous and the retina, causing a posterior vitreous detachment, which can cause one to see an increased amount of floaters. Now we have the retina. So light energy is going through all the structures in the eye, being absorbed in the retina and transformed into chemical energy. The retina consists of multiple layers. Here's the photoreceptor layer. It consists of the rods, responsible for your night vision and peripheral vision, and the cones, responsible for your color vision and central vision. The retina can be affected by different disease processes, including retinal detachments and diabetic retinopathy, which causes blood vessel breaks and leakages. Here is the macula, the dark pigmented region which allows you to see color in detail. It consists of zeaxanthine and lutein pigments. Macular degeneration occurs here and is initially treated with antioxidants and zinc therapy. In the center of the macula is the fovea, this yellowish dot. The fovea has the highest concentration of cones. This is responsible for your best and sharpest central vision. This is the optic nerve and what is called your blind spot. It consists of axons of ganglion cells which course all the way back to your brain. This area can also be affected by glaucoma. Now I will discuss the blood supply from the heart to the eye and back to the heart. The common carotid artery branches into the internal and external carotid artery and supplies blood to areas of the neck, head, and face. The internal carotid artery becomes a ophthalmic artery and supplies the eye. The central retinal artery supplies the inner nuclear layer and the nerve fiber layer within the retina. The short posterior arteries supply the back of the eye, choroid, and macula. The long posterior ciliary arteries supply the anterior parts of the eye. The venous system drains the eye and brings blood back to the heart. The central retinal vein drains the central retinal artery out of the optic nerve to the cavernous sinus. The vortex veins are located in each quadrant posterior to the equator and drain the choroid. Basically, the eye has a very extensive blood supply. This is why systemic diseases which affect the blood vessels of the heart can also affect blood vessels in the eye. This is why it is so important to visit your optometrist and have a dilated eye exam to detect any eye diseases and prevent vision loss. Now, onto the skull. The eye sits in the orbit, protected by the bones of the orbit. On the roof is the frontal bone and lesser wing of the sphenoid bone. On the lateral wall, there is a greater wing of sphenoid and the zygomatic bone. The medial wall consists of the ethmoid, lacrimal, maxilla, and sphenoid bones. On the floor is a maxillary, palatine, and zygomatic bone. The floor is the weakest bone. This area is most often fractured if someone is punched in the eye, so go to a doctor if you happen to get in a fight. Here is a superior view into the skull. Here is the sella turcica, the optic canal, the superior orbital fissure, which is a gap between the greater and lesser wing, and the cavernous sinus, which is a channel of venous blood. All these foramens, or gaps in the skull, are where you have all the nerve supply coursing through. The cranial nerves course through the cavernous sinus, through the superior orbital fissure, to the common tendinous ring, to the eye. Cranial nerves 2 through 7 innervate the different structures in the eye. This is what controls the eye to do things such as blink, tear, and focus on objects. Infections which involve the face, such as orbital cellulitis and meningitis, can be very dangerous because there are potential spaces through your skull and bloodstream coursing through, which is in close proximity to the brain and spinal cord. So there is a broad overview of the anatomy of the human eye. If you made it this far, thank you so much for watching. I hope you have a better understanding of how the eye works. I hope to see you next time.